sinus headaches, and let's even go into the migraine world a little bit. Do they get relief?
Yes, and we do know that sinus infections can trigger migraines or vascular headaches. We know that. So generally headaches that are due to the sinus infection or sinus obstruction get better. And then oftentimes we do see a decrease in the triggering of migraine or vascular headaches. So if, for example, you notice your migraine headaches get 40 to 60% better after the balloon sinuplasty, well, then 40 to 60% of your headache problem was triggered by chronic sinus infection. However, the other 40%, you have to look at what's the traditional triggers also.
Mm-hmm. Very good.
Okay.
Okay, good, good. All right.
I think
Where you wanna go next?
the next thing I would probably do is talk about what I think is the big secret weapon, is the fact that we're using irrigations now.
Okay.
You know, people for years now have basically wanted to use neti pots and bayou water, and they've gotten in trouble with it. But I'm actually a big fan of irrigation, and if people want to irrigate their own nose and sinuses, I'm like, well, then why don't we at least put medicines in there that work? And so maybe we could talk about, we get cultures before the procedure to get the name of the bacteria, which antibiotics works and which ones don't.
All right, I know where I could lead you into that.
And we can dissolve the antibiotics in the irrigation so that people are not having to take it by mouth or antibiotics by injection. Therefore, you're not going to create resistant bacteria, and it's very rare to have allergic reactions to topical antibiotics. So,
okay.
And then it's more inexpensive. Then, if we find out a patient has significant allergy problems, we can add allergy medicines to dissolve into the irrigation. One of the things I like about the irrigation